Marin City Health and Wellness Center is a federally qualified health center, and our sites are predominantly in African American communities because our mission is African American health equity. And I brought along Zared, who we call the chief of whatever, and tell him to do it. So, how many of you have, I'm a midwife, as well as a CEO, but how many of you have ever heard that Black women have the worst pregnancy outcomes in the nation? Right. I thought you would say that, and for 20 years as a midwife, I've been working to address that outrageous disparity in healthcare outcomes. But I also want to know how many of you knew that depending upon where you live, 50%, up to 50% of Black boys don't finish school. That's an equally outrageous disparity. And so for us, that disparity got really real in January of this year. I started as the CEO of Marin City Health and Wellness Center about 5 years ago, and we immediately started partnering with 4 schools in Marin County, in which in all the schools, Black children were struggling the most. And really a small percentage of Black children were finishing high school. So we started by expanding our preventative behavioral health programs, and we started to do facilitated groups with Black children who had been identified as behavioral challenges throughout the county. And so the school referred these children to us and we would sit with them. And we ended that first year taking the children on an educational 4-week trip around the country, and it was very, very strategic. The stops that we made on what we called the quality of life road trip were designed to show Black children that they were not alone. So we took them to learn about food, and Whole Foods hosted them in Detroit, and we took them to learn about education. We went to all the Black colleges, but we also went to Harvard, and the Black Student Union hosted them. We learned about so many things, but the themes and the stops were designed from what we heard from them that year. Flash forward to this year. So over the course of those 5 years, there have been many emergency meetings in our community, and those meetings were to tell us that the school that we worked with that went to the 8th grade did not have one child graduating the 8th grade that read above a 4th grade level. And somehow they still passed and went to high school. So I bet you would think that you would know that those children did not graduate, could not compete in the schools in Marin County. But we continued to work with these children, so we knew that they weren't stupid, and we even knew that they really weren't behavioral challenges, even though they were highly medicated and labeled in the behavioral health system. So recently in Marin,
try the right button.
Right. So recently a group came out and they addressed a report, race counts report, and it was a California report that was done, and in that report they dealt with education in Marin. Marin scored as the highest performing county in California with the greatest disparity. And so they talked about education. I'm just gonna really quickly go through these slides because what it's basically saying is that out of all the children, Black children are struggling to read and be proficient in English. We get suspended more, we're criminalized more, we're not prepared to compete, we're incarcerated in the county more. It's not fair. It showed that Marin County had the greatest disparity. So I talked to you a little bit about the programs that we had started before the school. For the girls, it was called Girl Power. For the boys, it was called the Defenders. This was a strategic position we placed ourselves in before we just opened the school. And Zared leads the Defenders. So we just wanted to talk about part of the solution, and he's gonna quickly tell you about the Defenders program.
Thank you. So very briefly, the Defenders is not a program, the Defenders and Girl Power, but more specifically the Defenders. It's not a program that's designed to just tackle academics. It's not just designed to give them something to do to keep them out of trouble. And the reason is, looking down the line, in this line of work, we've met several people who do similar work, but are much older, and they are worn out, and they have been working themselves tirelessly, not really making much headway. So looking at that and factoring it into the population that we're working with, the ideas that came to mind is, how do we get to the root of the problem? How do we help them deal with their toxic trauma? How do we help them to heal? So the program is designed to build a connection to each young child that is a part of the program, see what they need, and then to help them get what they need. And chart out a success plan with that child. And one of the greatest tools has been traveling. So each year in the summertime, we do a big trip, whether it's around the country or whether it's out of the country. Out of the country is a lot better because it doesn't involve driving state to state. But that's just me. And throughout the school year, depending on which school the children go to, my classes are there one day out of the week for a period of their school day, and then I also meet with them on the weekends to do some leisure activities. Sometimes we go to the movies, sometimes we go paintballing. So it's not always about work. Yes. And nonetheless, it's working. And one of the major keys is to not give them your vision for where you would like for them to be. Is meeting them where they're at and then building them up from there. And that takes a lot of time, it takes a lot of patience, and most importantly, it takes a lot of love. So in the first year of the Defenders, we started off with 6 boys, and then by the end of that school year, well, really it started in the summertime with the road trip, but by the time we came back from the road trip in August, by the end of that school year, the program grew from 6 to 55. And that was just a sign that we were doing something right. And it continues to grow to this day, but that's about it because she wants the money. Right?
So what he's trying to say is that we partner with the children who were struggling academically, and we put them in a group of peers, and we worked with them outside of the community and outside of the school year to supplement their education with tasting it, feeling it, hearing it, seeing it. We worked with the school to identify concepts that the children struggled with, and we planned our outings around that. An example is we went to Chicago, and they were learning geography. We visited a Great Lake. They had issues with geography. We talked about lakes. We talked about what made that lake different. We got in the lake. We did things so that they forever know what a lake is. And so the Defenders and Girl Power started as a partnership with the schools, but our children were still struggling. The same children we worked with for 4 or 5 years could not read and could not pass class. And we knew that wasn't real because we worked with them. There was something that wasn't happening. And so in January of 2018, we couldn't take it anymore, and we started a school. Our clinic started a school. We don't know how to be a school, but we could not allow these same children to fail. So we took really smart people, and we took very little advice. Because if the school is not a local problem, it's a national problem where Black children are not having the same experience as other children. And so we didn't want to hear from all of the really, really smart academics, because we keep getting smarter and smarter as a people. But we keep the issues that we have keep getting greater and greater. So we know we needed another approach, and we started a school within the clinic. So we have students who are struggling. We have one 11th grader who has 5 credits. A few of our children were in the criminal justice system. We just came back from Haiti, and one of the probation officers had to come cut an ankle bracelet off of somebody's leg so that they can go. We took this group of children and we said, we are going to make sure they can read, and we're going to do it in a way that makes sense. Because we think that if you have one child and 11 people who have to work with that child, something has went horribly wrong, period. Something has went wrong. If you get a child and they have a social worker, a caseworker, a group of teachers, a behavioral health professional, this person doing an intervention, something has went wrong. Why can't our children learn anymore? So our children are taught by a OBGYN for science, and they're taught by a drama group for drama, and they go to a farm and they're reading. We have they're going to do like bloody experiments next year from our chief medical officer. So it's just an alternative way to learn. And so here are some shots of our little humble school and clinic from when CCI did a visit there. But we took this one shot. I wanted to put this email up. We just came back from Haiti, where we did a lot of history and education in Haiti. And this was one of our children that is fighting a criminal justice case right now in the community. Like, the school just didn't know what to do with her. And she sent this email to her teacher when she came back, asking her about an assignment and putting XOXO at the bottom. We thought that was the best thing ever. You would have to know this child, but showing that these children want to learn, but there's a disconnect between the system and they're not able to learn. And this was one of the children that had the most critical feedback from the school system and was slated not to graduate. That doesn't look like the email of a child who doesn't want to graduate. But the ingredients had to be different. I'm sorry if you couldn't read it. So you can see through here, I have some of my favorite quotes by warriors. So what are our challenges? Money, of course, and because people want to know, what are you guys doing with those children, and what are you going to do with the money that we give you to have these children? Time, and then space. I told you we took a part of a clinic and we put a school in the clinic, and so it's challenging. We have a lot of volunteers. Some of our health experts are becoming educators, and they're just volunteering because they're interested in the children doing better. And then staff experts from a shared culture. So we are making sure, here is the lead teacher. I know I said chief of whatever, but he's the teacher and they all love him and they all show up. But we're making sure that Black children see Black people. We're making sure that they get to be the hero in their story. Because could it be that Black children are really tired of going to school and learning that everyone else has this incredible history except them, and everyone else is a superhero but not them? So the whole basis of our school is designed around making Black children see themselves as rock stars in history, because they are. And so when people who come from their community or have been around their community introduce that information, it seems real. When we discipline our children from a cultural perspective, it is real. I heard somebody say PPP, or the parenting. They're always trying to tell us to do that parenting class in Marin City. Consider the fact that we know how to parent our children, and we don't want to learn how you all parent your children, because we have tools to parent our own children, and they used to work before the introduction of crack cocaine. That destroyed our parenting in our community, and we're still trying to heal from that. So we put people in front of the children who get that. So when children exhibit behavior that we know is directly attached to that culture, we know how to address it. We know they're not threatening. We know their behavior is appropriate. We know how to deal with their behavior, and we're not going to exclude them from anything. So they have to show up and be accountable. In this report I told you about, Marin County was also the most democratic county in the state, which meant that they vote, So we were at another event and someone made a comment that we need to vote in our best interest. We have to vote so that we can get the change we need. Black people are less than 3% in Marin County and less than 5% in San Francisco, where we were. There's no way we can vote in our best interest. We have to count on other people to vote in our interest, which makes me question the democracy, because we're still having the same issues when letting other nice people vote in our interest. This was my favorite journalist when I was growing up. So collaborations. We had some challenges around collaborations, because once we made this risk to do this school and not really having a clear plan to do this school, everyone wanted a piece of it. So we had to decide who we were going to partner with, because we don't believe we need to partner with everybody. We believe that's part of the problem. We believe we need real clear messaging for our children, and we have to be very strategic about who we partner with, which was a challenge because we were contacted by 40 or 50 agencies. We did end up partnering with the youth court because a lot of our children are in the criminal justice system. And we did a little work with probation because a lot of our children are on probation. And we did some partnering and are doing some partnering with the county of Marin because we should be. Because it's not only our responsibility, and they've been a good partner. But there were lots of other partners that wanted to partner with us, and we didn't do it because we are still working on trust with our children. And it's important that we let them know that we're on their side. So when some partners that they didn't feel good about came, we didn't partner with them. Then we had to think about the right amount of partnership. And a good example is we have this theater that works with our children, and they love to go because they're making this play, Black Wall Street. They get to sing and dance and act up, and they love it. Well, the theater wanted more time. They wanted to work with them more. They wanted to have a whole day. They proposed all of this good stuff, and it sounded good to us, and we said, okay. And the children got together, and they presented a whole case on why they weren't going to do it. Because they liked the theater, but they only liked it for the theater time, and they didn't want to do anything else. So we heard them and we honored that. But it was difficult for the theater to hear because they were excited about it. But it was a good reminder for us of what we're trying to do. And that is to focus the children on what feels good to the children. They all want to learn, but they're trying to tell us how to teach them. All of them can learn, but not the same way. And we're trying to honor that, because once they decide that they're going to learn, they show up. They don't have to come to our school, it's in a clinic, but they come because they all have expressed wanting to finish. Lastly, it takes, advice for others, it takes the right person and not the right degree. I told you an OBGYN teaches science. That's really hard for some people. They're like, who teaches at your school? You know, do they have this credential and that credential? And I'm always wondering, well, the people at the school have that credential and our children still aren't learning, so that could not be the answer. But I want to submit that in the Black community, before crack cocaine, because that's a whole nother, I can come back and do a whole nother session on that. We had a character called Big Mama. Am I telling the truth? Big Mama was big in our community because she was wise, she held the family together, she gave us good advice. Everybody talked to Big Mama because she knew. So she did stuff like, if the child is hungry, I'ma feed him. That's all, because the child is hungry and I have food, so this is a connection. Or she reminded us, you don't do stuff like that. We don't do this. This is not how we show up. That was a character for us. That has been replaced. So I just want you to sit with this. Big Mama has been replaced by the 10 people in the room. The child is hungry. Well, let's get the child over to a caseworker. The caseworker needs to do an application to get it to the food bank, because we need to see if there's a fit with the food bank, because they might have to go to CPS, because why isn't the child being fed? We have got to stop that, because this is why the children can't learn. Yes, we have trauma. Everybody in this room, I scored 9 on the ACEs test. We all have trauma, but there was a way that we worked things out, and we have lost that because we got so smart. We're just so smart, but we can't seem to solve a problem with 10-year-olds. And the best person to do that is mama, auntie, cousin. We know how to do that in our community, but we have lost the knowledge that we have that. We will overlook a qualified person because she doesn't show up with a PhD. And she had the best advice of all. At our school, we have a woman who's from the community, and she's an elder, Miss Diane. If you act up at school, you have to go downstairs to Miss Diane. That is the worst punishment ever, because she's gonna sit and look at you like this and then tell you, I'm telling your mama. But we lost that, and that's the most respected punishment that we can have. The next thing is just having facilitators and teachers, again, that are part of the community and that they can relate to. Zared has a following. He's not from the Bay Area. I stole him from South Carolina. I met him when I was in South Carolina, and I made him come here because he was the right person to do this work. And in 4 years, he has such a following that, like he said, it didn't start out with him working on weekends, but now on weekends, he takes the children to Pismo Beach. He doesn't give them free time. If a movie comes out, they go to the movies. This is not about school. This is about life, because if we can get rid of those outside barriers to learning, the children will learn. But learning is a discipline. And because we've lost the courage to put the discipline part in it without judging, then the children can't learn. And so that's what we're doing at Marin City Health and Wellness Center with our new school, Marin City Health and Wellness. What is it? Marin City Academy of Health and Wellness.
All right. Questions, curiosities? They're a powerhouse, so.
This is my daughter's shirt. She's deaf and she's an activist, and I promised her I would wear this shirt today. So I have to get that on video to send it to her.
Thank you for this powerful presentation. It definitely affected all of us. So congratulations on your success also. The question is, while you're working really hard on trying to get them to finish high school, are there also plans for getting them into the workforce to help them transition from this and then to also get jobs and,
Yes.
to be able to support themselves?
Yes, we do a lot of work around entrepreneurship and the acknowledgement that one of the things we have to bring back to the Black community is small business. So we don't only put college as an option, we're working on a partnership with the College of Marin so that they can get some vocational training. But we do a lot of work around that because we believe as an organization that we have to make space for people to be entrepreneurs and to save their community. I don't know if that answers it, but we do have partnerships. Okay. That's it.
Well, this isn't really a question, but I just want to applaud you all for what you're doing. At the East Oakland Youth Development Center, we work with a it sounds like similar population. And I, to that end, really think it's great that you have room for near peer or peer support, because that's something that has been very, very powerful for us at the center. So again, just want to applaud you all for what you're doing. Keep doing what you're doing. Very important work.
Thank you.
Amazing presentation. Quick question. How did you get buy-in to use a space in your clinic that will not produce revenue?
Negotiating. So I had to get, I had to negotiate with my board. Knowing my board sits an educator, and one of the things that I did was promise not to mess with the middle school yet. So that's why we started with only high school, and it minimized the amount of space that we needed. But it was a negotiating thing. One of the things that helped is that our board is very supportive of this program. And so we knew, it wasn't only me, the board supported me in knowing that we have to do something. These are our children. And so, with that one little give of not doing middle school yet, we were able to do that. Also remembering that we don't need a lot of stuff. We have one room. It's about almost half of the size of this. And we just use it. We don't need a lot of stuff, especially with volunteers. We buy what we need. And I think that makes it easier. And everyone in the clinic has bought in, so it's okay.
Yeah, I'm just wondering, with the huge need in your community, how do you decide who gets into the school? Or you have limited capacity right now. So what does that process look like? And then how do you continue to engage both the kids and the community, the families, in kind of your next steps and
Mhm.
community design?
So we have a list of children who are waiting to get in this current year, this upcoming year. So we started in January, so it was kind of spur of the moment. Some parents were like, what is this? And we had 8 children. We wanted 11. It looks like we'll have more than 11 next year. But remember, we are taking the children who have quit school, they're not gonna graduate. There's a certain population, which makes it difficult because we don't have that balance. We don't have a child doing well that we can partner with. So it really is, that's the difficult part of the school. But because it's that population, there's not like 100 people getting in, we have maybe 20. And, we hope that we will find a way to make it work so that we can have another space and we can accommodate. We would like to accommodate every child who needs a route out of school. I didn't mention in the presentation, but we look at their academic file, we assess them, and then we offer them 3 routes and they choose. Either we're gonna work with you toward the GED, we're gonna work with you toward the California proficiency exam, or your credits look good and we can work with you realistically for you to graduate. So they drive that.
Thank you for that innovative work. We often talk of community health centers as being anchor institutions, building clinics within school or other programs with clinics. And I'm just curious to know if nationally other community health centers are doing this, if you've seen this elsewhere where they're actually building a school in the community health center.
We looked and we couldn't find an example of an FQHC doing the school on their own. We found some partnerships. One of the partnerships was in LA, but it wasn't the FQHC that led the effort. So we'd like to find someone else so that we can learn from them and, we don't want to reinvent the wheel all the way. Lots of the wheel we want to reinvent, but if there's another FQHC that has some tips for us, we want to do it. We do that a lot. We have a birth center as part of our FQHC, a freestanding birth center, and we looked and we did find 3 FQHCs that have birth centers, but we're always in this situation.
Is there another slide you want to share with another favorite quote?
Which one?
The next one.
She must know, huh? Oh.
That's our program.
So my heart is still pounding from the adrenaline rush from your presentation, and I could watch it again over and over. But from that FQHC standpoint, I am curious. Is there an advantage from what you've seen? And I know we don't have other examples to doing this through a community health center. For instance, did you apply for a change of scope and fold the school in? And what did your federal project officer say? I mean, this is a phenomenal idea.
We didn't. We didn't because we're trying to figure out how we're going to proceed with that and how even, we want to know how to do that.
This is the ultimate enabling service. So it lines up, very much with the spirit of what health centers are trying to accomplish and to fight poverty. What better way? So congratulations and thank you.
Thank you. Yeah, we have a site visit coming up in the beginning of September. So it's going to be like, surprise!
Okay, I think that's a wonderful note to finish on. You gotta being mavericks. Are doing what they think is right. So thank you all. We've got time for a quick break. This is also a chance to share your notes if you haven't done that yet, the ones that you wrote. We'll have 10 minutes or so, and then this is also a chance if the sponsors need to head out and the Innovation Lab teams who've been generous with their time. And then we'll come back for just last thoughts with the catalyst before we call it a day.